Hi there, it's Dr. Mashhood again here with a new video on COVID-19. The question we're going to discuss today is whether the second wave will come or not. Second wave in COVID-19 is a topic which has been discussed widely these days. There are countries which are still tackling the first wave, but there are countries which declared themselves that they had controlled the COVID-19 infection and now they have seen a re-emergence of COVID-19 infections. So what is a second wave? In any pandemic, any infection which has been declared a pandemic, the disease infects in different phases or waves. And these phases are historically called the first wave, second wave, and the third wave. Now, if we historically look at the data of the different diseases which has come around in our time, there are three main examples which we can look at. The first one is the Black Death of 1300, which again came in different phases or waves and caused a lot of casualties. The second one is the Bubonic plague of 1500, which again came in different phases or waves. And the most recent one is the Spanish flu of 1918, which came in three phases: the first wave, second wave, and the third wave. Now, Spanish flu is important to note because it got quite similar signs and symptoms with COVID-19 or the coronavirus. When we talk about Spanish flu, the first wave of Spanish flu came in June, July of 1918. Subsequently, it was noted that in October, November, and December of 1918, the infections were re-emerging, and this was declared as a second wave of Spanish flu. The third wave came slightly later in February, March of 1919. Among the first, second, and third waves of the Spanish flu, the second wave caused the most number of deaths or casualties among all the population it infected. At that time, in 1918, they did social distancing, but the prime example to note is of two cities, Philadelphia and St. Louis. Now, St. Louis implemented social distancing and other measures very soon as compared to Philadelphia. Actually, there was a parade in the middle of the pandemic of 1918 in Philadelphia where they did not practice social distancing. And surprisingly, 3 days after the parade ended, there was no bed available in any of the hospitals in Philadelphia. So in summary, that's the importance of social distancing. Now, where do we stand with the current situation? Now, if you all remember, New Zealand declared itself COVID-free a very short while ago, but since being 24 days COVID-free, it has started to see emergence of COVID-19 infection in New Zealand. Now, China, especially Beijing, declared that they had controlled COVID-19, but after 50 days of having no COVID-19 infections, now they're starting to see cluster of COVID-19 infections in Beijing. Two more examples, South Korea and Singapore. Now, South Korea and Singapore were deemed as a prime example of how we tackle COVID-19. The way they did it was strict social distancing and very effective implementation of track, trace, and testing strategy. Now, even South Korea and Singapore are seeing re-emergence of COVID-19 infection. And among these countries and others, the concern is the second wave has already started of COVID-19. Now, it's very important to remember there are still countries like India, Pakistan, Brazil, and many more, which are still struggling with controlling the first wave of COVID-19. And second wave, it hit these countries quite later on. How do we deal with second wave of COVID-19? Well, there are certain advancement in technologies compared to, let's say, Spanish flu, which will make it easier to control second wave. And the global supply chain of the medical equipment is much far advanced and developed compared to previously in the history. And remember, there are much better communication tools in social media. And now that could be used effectively in improving awareness and also reaching out to people who need help and advice. Now, one of the most important factors which can affect the re-emergence of COVID-19 in countries which have controlled the COVID-19 infection initially is the relaxation of the lockdown. Now, relaxation in lockdown have been implemented because some of the countries, in fact most of the countries, are feeling the economic downfall from the lockdown effects in controlling COVID-19. Now, winter is coming in most of the countries around the world, and we will see seasonal variations. And in winter is notoriously known to cause more influenza or seasonal flu infections. Now, the other thing to remember is the COVID-19 virus mutation. There are people, scientists, and in medical fraternity, the concern is whether this virus is mutating continuously. And if it is, it would be really difficult to develop the vaccine. And the development of effective vaccine is essential in how we tackle the COVID-19 in the near future. But still, the vaccine is still 5-6 months far away. So the sooner the vaccine gets developed, the better control we have of COVID-19 infection. So to summarize, this is not the right question that if the second wave will come. The right question is when the second wave will come. Please like the video and subscribe to the channel.